11, when I'll talk to local and regional authors. So please join me Wednesdays here on 90.9 FM KSJE Farmington.
Good morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning. It is Monday, May the 4th.
That's what they say. Oh, are you going to do it?
Not yet.
Okay.
I don't think so. Maybe towards the end of the show.
Okay.
We can talk about that.
Cool.
Then.
Stick around.
But yeah, exactly. Good to have you all with us for our local community information program about COVID-19. We're doing this again Monday through Thursday. I'm not trying to have to keep saying that because we've been doing this now for how many weeks? So
yeah, but
I think everybody knows.
7, I think. But still, like, you know, we can have new listeners. Sorry,
That too.
It's like a visitor because it's online.
Visitor, viewers, listeners.
Right.
We're open to equal
We're
opportunity
open to all of that.
program.
Callers.
Here. Exactly. So in fact, we're going to be Facebook streaming here.
Are we still setting that up?
We're still setting that up.
Okay, cool.
So
cool.
I'm going to share it right now.
Great.
With our other groups.
So, did you
Share it to a
see
group.
the
Okay.
thing about murder hornets this weekend?
I did. Yeah. What else could go? What else could we do with
go
this
wrong,
year?
guys?
You know?
I'm just wondering
Thanks.
which Texas football team is going to change their name to the Murder Hornets.
Now that'd be awesome.
Yeah, and as
I can
somebody,
maybe get behind that. The insect, not so much.
I can get behind. Yeah, that's right. I think they're already making Murder Hornet T-shirts in Texas, of course. And as somebody who originated from Texas, they take their football seriously. It's only a matter of time. But yeah, you're right. Like, what else can go wrong? How did those happen? Is that another mutation from the killer bees or something?
Yeah, I don't know. I need to look at that story to see where they came from. But I think it's the Washington State area. That's kind of where we're noticing
See,
them.
There it is again. Those poor guys, they've been hit hard, Washington State area.
Right.
If the murder hornet had a good lawyer, they'd be the manslaughter bees.
Oh, maybe.
Do you get that?
I get that.
Okay.
I like it.
Cool. I like it too. I'm pretty proud of that, clearly.
Very nice. Okay, we're shared to our groups
Okay,
here,
cool,
so
cool.
we're glad that you are all with us. Good morning. And so anyway, murder hornets. Yeah. No,
Yeah,
no, thank you.
Right, exactly. So we're waiting around for the next plague, I guess,
Yeah.
amongst all the plagues.
Right.
Speaking of plagues, numbers?
Yeah. Okay. Yes.
Are we doing that?
We can.
So
Getting them.
the Gallup lockdown was extended to May 7th.
It was.
It was originally on the weekend only, and it was supposed to end today.
And
but
today. Mm-hmm.
we had a little extension.
We did. And again, I think it's good to point out, though, that, you know, the governor didn't just do this by herself. She was asked by the mayors of Gallup. There was an outgoing mayor, there was an election, and so there was a mayor who was ending his term of office, and the incoming mayor, and they both agreed to reach out to the governor to ask her to do this.
That's
because
right.
the cases in McKinley County, as we've talked about on this program, are just almost off the charts. I mean, they are leading the state, and they don't have the population numbers, even like San Juan County. It's smaller than San Juan County, smaller certainly than Bernalillo County, where Albuquerque is, yet they have higher numbers than both of us. So
That's right.
That's the concern, and I understand that. I also understand why the governor said, you know, we're easing restrictions, and these are our phases to get the state reopened, and we're doing all of this, but not you, or you, these three counties in the northwest part of the state.
It was a little more eloquent than that.
San Juan, McKinley, and Cibola.
You're not picked for the team.
Right.
Yeah. No.
I was a little disappointed, though, that wasn't. It was kind of burying the lead a little bit
It was.
in my regard from
It did.
her press conference.
It did.
that they went through all this about the reopening and the phases,
Right.
and then an hour and 40 minutes in is when we find out San Juan, McKinley,
Right.
and Cibola counties aren't part
Right.
of this.
Which is a giant bearing of the lead.
and the
Because you got to stick it out for an hour and 40 minutes.
yeah, and the press release that came out after that didn't talk anything about the three counties
Yes.
that weren't involved with it either. So I had a little bit of a problem.
It took some time to
with
get there. I was like, oh, this is really
Well, and there was a lot of
yeah.
confusion for the local
Yes.
governments and local folks
Yeah.
and people are turning to us for information, and we're like, well, we think we're opening, but maybe we're not.
But maybe we're not. Yeah.
and the news is that we are not. Everyone,
That's
San
right.
Juan County is not under these.
still on, we're
restrictions.
still on the same restrictions. That's
Correct.
right.
So there is that. But we can look at
Yes.
numbers, and we're happy to share them. Again, it was kind of a big weekend with more cases, and that's the issue that these folks are looking at, I think, as we talk to some folks about what we're seeing. 118 new cases on Sunday. I think there were almost as many, if not more, on Saturday. And we're now at 3,850 in New Mexico, right? And 26 Sunday in San Juan County, so we're at 736. 12 new deaths. Of those 12, half were here in San Juan County on Sunday, and then 30 more recoveries. And I think that was about the same, too, on Saturday. So that's maybe about 60 more recoveries over the weekend.
Yeah.
So we have that. And again, we are getting this information from our website, ksje.com, under news. We've got a lot of COVID-19 stories kind of compiled there for the local area. As you can see, the daily statistics there are there. The extension of the Gallup lockdown now till Thursday at noon, just to put a period about that. The other thing I wanted to mention, too, though, is there's some free COVID-19 testing this week, today and tomorrow, in both Shiprock today and tomorrow, Crown Point, New Mexico, Wednesday and Thursday. Kind of the same thing we saw at McGee Park last week.
right.
It was going to be a drive-through situation, and so it's going to mean more positive cases, but it's also going to mean we know where some of these outbreaks are, and that's a good thing.
That
As
is
we
a
talk
good
about
thing.
testing with our doctors
That's
and
right.
everybody else, right?
But again, the testing is for first responders and symptomatic people.
Right.
So
Essential workers.
Right, essential workers.
And if you're working maybe in a nursing home or a hospital and you want to, get
and
tested.
you might be asymptomatic, which we know is a thing with
That's
this
right.
disease.
Exactly.
Yes.
So I think it's great that they are rolling those out in those other areas because we know, again, the reservation is seeing a lot of cases. And so that's a concern. And to scroll
In
down a
fact,
little bit
they've
more.
opened up a overflow facility at Northwest High School in Shiprock.
Right. From the hospital, right?
Right.
To deal with more patients.
Right. So right now there's no patients there, but they installed some new things and converted it to this.
Right.
National Guard converted it to this overflow
Exactly.
facility.
The numbers from the Navajo Nation, we got some numbers, I think, on Friday, but they didn't update them over the weekend, so we'll be looking for those updated numbers today. But they were plus 166 cases on Friday and 2 additional deaths. So there's that number and that story on our website as well. So there's that going on. But yeah, so I think folks are understandably concerned about these numbers. The state certainly is, and that's why we are not allowed to have friends over yet, to quote a friend of
know.
mine. Yeah, we're still in timeout.
Yeah, that's rough. That's a rough thing.
Right.
But the numbers really put it in stark perspective when we're talking about McKinley County, right? Because if you have around 3,800 statewide, and we had like 1,300 or so in McKinley, it was definitely over 1,000. That's it's quite a lot. They're sucking up a lot of that total, right?
Right.
So.
And again, McKinley County has a population of about 70,000 people. I think the city of Gallup is maybe 30,000 of that. Someone will correct me if I'm wrong, and I hope they do, but I think that's pretty close.
That's why we have Facebook commenting.
That's right.
So you can live correct us.
Exactly.
Yeah.
But if we go to the state website and the dashboard that we have enjoyed looking at, we can show you.
Love the dashboard.
Right, the latest at 11:44 in McKinley County, with 21 deaths. San Juan County, just to the north, we're at 736, and again, if I scroll down to Bernalillo County, which of course is Albuquerque, they're at 920.
Okay.
So and again, you can see from the colors, the hot spots in our state, and it's that
We are
northwest
red.
corner.
We are red.
So there we are. That's the issue. And again, this is linked to from our website. If you haven't seen this before, the state is compiling all this data into this dashboard that kind of shows it. You can drill down by zip code. if you want to. And again, that shows even in the areas of San Juan County where some of the higher cases are. We can show that as it really tries to load that up. There's a lot of zip codes.
That's right. Narrating for the video,
for the radio audience. Yes, exactly.
I'm always drawn to the age breakdown of cases.
Right. But take a look at them, this by color, of course, and so the most cases, 76 plus, are in red zip codes. And of course, green is good. But you can kind of see where, the 87401 zip code in Farmington is red.
It is
We
red.
have a lot of cases in that zip code, and some other zip codes to the western part of San Juan County, and in the Gallup area, you can see that too. So, there you go.
Right.
Yeah,
Scary stuff.
it is, and we need to get a handle on it, and that I think is part of what the state is trying to do. I don't know if we'll see a lockdown in other places. Again, it was asked for by the mayors, but certainly if that can help the Gallup area, we would hope that maybe folks in our area would not have to go to that extreme.
To be seen whether it helps the Gallup area, right?
Correct.
So, yeah, we'll see.
That's
Stand
the
by.
idea. But I think, again, for folks who are, again, if you live in Gallup, you're not locked down. You can still go out shopping and go do these essential things, but it's for folks who are going into the city, keeping them out,
Keep them out.
is my understanding. But
Yeah,
roadblocks,
right, mixed with please don't go out.
Well, yeah.
Yeah.
Right, stay at home.
Right.
That's the whole idea. The Navajo Nation is continuing their weekend curfews, again, those 57 hours, so there is that as well. So we'll see what that happens out there.
That's right.
Let's go to the phones.
All right, cool.
Are you ready to go to the phones?
I am.
Okay, Megan's ready to go to the phones. Good morning. You're on KSJE.
Hi, good morning, Scott and Megan. This is Jeff Bourgeois.
Hello, Mr. Bourgeois, President, CEO of San Juan Regional Medical Center, calling us every Monday to give us an update on conditions at the hospital, and so we appreciate that. What can you tell us this week?
Well, I can tell you this week we are busier in general across the hospital than we were last week. That includes for both non-COVID and COVID-related types of inpatient cases. This morning we have 30 positive cases in-house and another 9 patients for whom we are awaiting test results.
Okay.
But we have a total of 127 patients altogether.
I gotcha. And remind us again, Mr. Bourgeois, of the capacity of the hospital. How does that compare with that number?
We're licensed for 194 beds. Right now, it's a little altered due to some of our COVID-19 response activities. We have some of our bed designations have been changed on an interim basis to get us through this, and so we have a number of beds that are really just sitting idle in preparation for and planning for surge capacity should we need it.
So it sounds if you have an uptick in the census, how is this impacting the furlough plans? Is it at all?
Yes, Megan. We've called back a number of employees who have been furloughed to help us with our patient care demands. I don't know the exact number at the moment. What we're seeing across the state, particularly in the northwest region, McKinley, San Juan, and Cibola counties, is a growing demand on ICU beds. So we've been working at hospitals in each of those 3 counties, including Northern Navajo Medical Center, both the hospitals down in Grants and in Gallup as well. We coordinate with what's called a central command call center in Albuquerque so that we can move ICU patients to a central hub, and they help level load, if you will, evenly distribute the ICU cases across the state. Because, as you know, there are many parts of our state that have not been hit very hard by this yet. So we've moved patients over the weekend and going back into next week from our ICU to 2 hospitals in Albuquerque using that central command call center, which is part of the statewide disaster and emergency response planning activity.
So it sounds like the IHS, the Shiprock Hospital, is a little overwhelmed right now. Have you guys taken any patient overload from them?
Megan, I don't have our transfer data at my fingertips. I'll know that the ICU cases that are leaving Shiprock right now, I think for the most part are going into Albuquerque hospitals, as the Central Command Call Center wants us to save our capacity for our immediate needs, patients coming through the emergency department or otherwise arriving to the hospital via ambulance or by personal vehicle. So I don't think we've had very many transfers from Shiprock. As of last week, their non-ICU COVID capacity was well within their capabilities. And like so many other hospitals in heavily hit regions, the ICU capacity is what seems to get strained first. And I want to commend our state's medical advisory team and the leadership down there for having a nice plan to allow hospitals to help evenly distribute ICU demand.
And I was just going to ask you about that, Mr. Bourgeois, and that's kind of how the system is set up in our state and other states too, right? I mean, we have major medical facilities in Albuquerque in the population center, but San Juan Regional has certainly certain capacities and certain things that it can do here. But this is what happens even when there's not a pandemic, is if you have a serious illness or someone that needs more specialized care, they can be transported to the regional centers in every state for that higher level of care. Isn't that how it's designed to work?
That is true. However, what's different now, Scott, is that we might not, often right now when we're moving a patient, or any hospital is moving a patient now, it's not moving for a higher level of care necessarily. It's moving to make sure we can maintain as evenly a balanced ICU census across the hospitals as possible. Does that make sense?
It does, I think. Keeping that capacity available for other local patients. Is that what you're saying?
Right.
Yeah.
And
Mr.
I'm going to say, we are still, in these three counties that I've mentioned, Cibola, McKinley, and San Juan, we have not yet achieved a stable and declining incidence of new cases. And therefore, that's what led to the exemption or exception of those three counties from the governor's changes to our public health orders, and that's applicable for non-essential businesses as well as healthcare facilities. So. Right,
and that's what we're hoping to hopefully see here in the next few weeks, right? This flattening of the curve and all those things that folks are watching for. You mentioned, though, Mr. Bourgeois, that your census was up a little bit. So does that mean, I guess, that maybe folks have gotten the message that they could still come to the hospital for other problems? If people are having chest pains or other issues, that the hospital is still open for those types of situations, right?
That's exactly right, Scott. And I thank you for mentioning that. We really want to emphasize that. Not only have we seen some cases here where people have delayed care too long, but in talking to my colleagues across the state, that is not an unusual occurrence. People are just concerned, obviously, about coming to a hospital in this COVID-positive world we're in, but and therefore they delay getting necessary care. And so hospitals in Santa Fe and Albuquerque and other places are really trying to get the word out to their communities that do not delay your necessary care, particularly if it's an emergent or urgent issue around stroke, coronary, or any coronary care or any other type of care that is. If you feel you need to come to get emergent or urgent attention, please come. We've as I mentioned, we've got safety precautions in place at the hospital to protect.
Great, and this is always, I know, people's concerns, and there's a fear about this. But how are two things going? One is ventilators, we still good there. And the second is with PPP, particularly in regards to PPE, sorry, in regards to have the doctors had to switch to using those homemade masks, because I know the reason that they were saving those for patients, but the doctors were still good with like the official gear. So how are those two things going?
We are actually right now, Megan, we only have 4 intubated patients in the hospital, and that's the lowest we've been in quite a while. So we've got excellent ventilator capacity. We're not anywhere near our capacity level on ventilators, so we've got some nice cushion there. And on PPE, we're in good shape. We made some arrangements last week to get some more isolation gowns in, both disposable and reusable. We were getting if we had a pinch point last week on PPE, it was in the isolation gown category, and we've been able to restock. And I walked into our situation room today, and there were a number of PAPRs and PAPR hoods, which are the portable air purifying respirators. And what's important about those is the caregiver can wear that over their face, and that preserves the N95 mask. So a lot of good help from our community. So it's been wonderful to see, and we're in good shape right now on PPE.
That's good to hear, Mr. Bourgeois. And again, as we watch the rest of the state start to kind of reopen with some of these phases that the governor has talked about, and this economic recovery council that has been called from all parts of the state to advise the governor on all these things. There are some things, of course, if and when, hopefully it's more a matter of if or when San Juan County reopens or things start to resume. That would include maybe some elective procedures, correct? And so I imagine the hospital is standing by to be able to do that when it is deemed appropriate by the state.
By all means, we're anxious to get back to that type of work as well. Scott, I'm glad you mentioned that, because what I want to remind the audience of is that when a community conducts a large number of cases, you can expect to see the number of positive cases go up, right? So today and tomorrow in Shiprock, there's a big testing event being put on by the New Mexico Department of Health. So that we can expect, beginning maybe as early as tomorrow, but certainly Wednesday, Thursday, and Friday, to see some uptick in our number of new cases. What's important to really monitor across our county is the percentage of new cases over the total population tested. So we've been tracking that just with the tests that are run at the hospital. We're doing a 14-day rolling average of positive results as a percentage of the tests taken. And so we're right now, we're at 14.5%, and that is still quite a bit higher than the state average, and that's the number we need to see turn down and level off and then start declining. So,
and I guess, Mr. Bourgeois, with more tests, then that may help to drive that number down. If we get more tests, but we get more negative percentages from those tests, that might help bring that number down, or something a little more acceptable.
Exactly, and that's why it's important to think of new tests as a percentage of the total tests completed rather than just the absolute number. So I think with broader-based testing and testing asymptomatic people and others, that'll drive the number down and give us a rate that's a truer reflection of community spread within San Juan County. But the key message is now our rate is significantly higher in San Juan County than the rest of the state, and we need to do everything we can as a community to help prevent community spread. Masking, washing your hands, stay home, stay safe, follow the social distancing guidelines. It is it's really remarkable how easily this virus can spread just through seemingly innocent contact between family members and friends. So we want to continue to reinforce all the social distancing and personal hygiene principles that we've all been made aware of.
Good point. And I know, it's maybe getting more and more difficult for some folks as they see other parts of our state maybe reopening and other folks maybe being allowed to gather and those types of things. But I think it really is the keeping the eye on the ball, to use a baseball analogy, that we really need to keep going with this, even though here we are at, 7 weeks or so. But the numbers haven't quite turned as to what we are expecting. And as you mentioned, you're watching those numbers, the hospital's compiling those numbers, the testing numbers. And so it's really important. And again, for all your folks who are working at the front lines, Mr. Bourgeois, who are going to work every day and dealing with these patients and helping, hopefully, most of them get better, if not all of them. We really are doing this for them too, are we not?
Exactly right. That's the message you've probably seen any number of places across this whole COVID-19 response is healthcare providers working in the hospital. The message is, we stay at work for you. Please stay home for us. The quicker we can get our community spread rate to decline and decompress the demand on the ICU for these very sick COVID patients, the better. And it's a frustrating circumstance because so many people who might get exposed and contract the virus have a relatively mild course of illness. But for the 20% that don't, it can be devastating and life-ending. And those are the vulnerable people of our community that we seek to protect. And so we really urge everyone to please be respectful of everything that everyone has asked for relative to social distancing and personal hygiene safety.
Indeed. Well, we appreciate those words, Mr. Bourgeois, and your availability this week. Again, thank you for calling in and sharing this information with us and our audiences. Thank you very much.
My pleasure, Scott and Megan. Y'all have a wonderful day.
All right. You too. That is Jeff Bourgeois, everyone. He is the CEO of Salmon Regional Medical Center, joining us on our COVID-19 local information program, which is why we do this, because the keyword local, right?
Keyword local.
Yeah.
So it's great to have a man in the know locally.
Exactly.
Join us.
Well, and to give us the update from week to week.
Yeah.
And that's interesting, I think, about the numbers, the percentage of positives of those tests out of all the tests that they are doing.
Yes.
That's an interesting number that maybe we should start tracking.
We should start tracking
looking
that.
at,
And I also remembered when we were asking the docs on Thursday, Dr. Philpott mentioned we were talking about the false positive.
Right.
And so a negative test is super valuable, no questions asked, and there have been some cases of false positive tests. So just always keeping in mind the margin of error that scientists talk about.
Definitely. Very much so. We have another caller.
Ooh.
So shall we go back to the phones?
We should.
All right. Very good. Good morning. You're on KSJE.
Good morning, Scott. It's Liesl Dees.
Liesl Dees, the one
friend
and only
of the
Liesl
show.
Dees. Friend of the show, exactly. Liesl, how are you?
I am great. And, Scott, I want to say thank you for telling us what day it is, reminding us that it's Monday, because we're all, I don't know. I'm kind of losing track of the days. And I let a week go by without mentioning it when I call into your show, that it was National Volunteer Week from April 19th to 25th.
Oh, well.
There you go.
How about that?
How about that?
See? Very good.
That's why we have the one to help line,
I'm
right,
sorry
Liesl?
we missed it. Yes.
That's exactly right. That's my segue in this morning.
Perfect.
I'm calling on behalf of the Want to Help line. That is a partnership between San Juan County, the City of Farmington, the United Way, the local United Way, and San Juan College, where I work.
Excellent. And this has been up and running now for, 3 weeks, 4 weeks? As you mentioned, the time is fluid. I have no concept of time.
Time is always fluid, but
well,
yes,
true.
okay.
More
go
fluid
on.
than usual
go on.
these
okay.
days.
Okay.
And there are a couple of volunteer things that I want to give a particular emphasis to this morning. One is that Echo Food Bank is in need of volunteers these days, and they have a special COVID-19 package of information that if you are interested in volunteering at Echo, perhaps you need to just get out of the house and do something different. They would love to have that different be coming to do this with them. They have a very specific COVID-19 package that you can find on their website. If you go to echoinc.org, you'll find a multi-page, 7-page packet of information around volunteering during COVID-19. They have a number of things that they encourage people not to volunteer. If you are in a high-risk category, if you have been in contact with someone who has been diagnosed with COVID-19, if you are sick or showing flu-like symptoms, they do not want you to volunteer right now, but they really do want volunteers. So if you follow their criteria and you are kind of willing to abide by the things that they say in here, they've got a checklist to fill out that's a screening questionnaire, they could really use some help down at Echo. And they are doing this by appointment now, so they would really like you to fill out the questionnaire and then contact them with that.
Okay, good to know. And again, it kind of showcases a little bit about the fine line that some of these organizations are having to walk, right? You want volunteers, but you want healthy volunteers, and you want to make sure everyone's still safe and all those different restrictions, correct?
That is exactly right. Volunteering in the age of COVID is a little different these days.
Indeed.
And there may be ways that we can help that aren't exact volunteering, but maybe doing other things. And so a second volunteer or way to help opportunity that I want to point out is through the Navajo Nation. They have come out with an excellent website that gives a lot of needs listed on their website. And it's nndoh.org/donate.html. And if you're not writing that down right now, you can go to the Want to Help line website, and you'll find all of the information and the links that I'm talking about here on our website at the Want to Help line.
Very good. And Liesl Dees, again, this is great because I know a lot of folks maybe see a lot of these posts maybe on social media for donations and things like that, and you kind of wonder, is this legit? Is this something not legit? You've done all the homework to let us know that this is a good place to go for information and to be able to know if you're donating, the money's going to get to where it is supposed to go, right?
And the website that I'm mentioning here is officially from the Navajo Nation.
Right.
And they have a lot of specific detail on here. They have information about how to send monetary donations, if that's what you want to do. One of the things that I really like on their website is that they are giving you a mailing address in Window Rock that they would love to have homemade cloth and fabric masks sent to this mailing address. So if you are part of the Army of Mask Makers or you're thinking about joining the Army of Mask Makers, here's an address that you can send things to. And I think particularly if you are looking at media and your heart is broken when you see things on the Navajo Nation, here's a long list of things that they are asking for and that you can help with.
Very good. And your website, we should mention, Liesl Dees, this is kind of the Want to Helpline website that's been produced through the City of Farmington's website, correct? It's really through their page, fmtn.org.
Yep, that's exactly right, fmtn.org. And if you go to the COVID-19 section there, you'll find ways to help, want to help, as one of the links that you can click on. And with that, and you can find this information at the Want to Help line website, we have a phone number that you can call, and that is 566-4210. And we have people there who will share the information that is on our website. We'll share the same spreadsheet that you can click on and look at on our website. But the great thing about calling to our website, calling to our helpline, is that we then know that you want to volunteer. And we've had a couple of things recently, like with ECHO this week. They reached out and said, we really need volunteers. So we called back people who had told us they wanted to volunteer. So as needs change, if you call us, there's a decent chance that in the future we may be calling you back. So we appreciate hearing from people, and oftentimes people who have connection to other people who want to help volunteer. Say you're part of a civic organization or that's not meeting right now, or you are part of a Sunday school class or a church group or some kind of organization that wants to help others, maybe just a group of friends that yeah, I've got 5 friends I could call who would be happy to help out right now. Because we're all in different places right now. We all have different ways that we are responding to this. Some people have no time, and some people have lots of time. So
right.
Just know where you are and what you could do that would help others.
So if I was a nonprofit organization that was looking for volunteers, how do I get to you guys?
Same number, 566-4210. And if you've got specific things that we can add to our spreadsheet, we would absolutely love that. So love to hear from organizations who would need help. And it may not just be volunteers. We're not looking for things that are just financial contributions, but oftentimes there is a local need that just may be a little unusual, maybe something that people aren't looking that aren't thinking of these days. So, for example, when the hospital put out a call for looking for, I'm going to have to sit down and look at what it's called, so make sure I call it the right thing. CPAP machines. Any CPAP machines that they were not currently using, to consider donating it to the hospital. And of course, needs are going to kind of change and come and go, but things like that we might not think of what's sitting in our closet as a way to help, but certainly there are different needs right now.
That's very true. Well, Liesl, thank you so much for calling in again this week and giving us an update again. And again, when you go to the city's website, you can kind of link to that spreadsheet and see all the different projects that are in need of volunteers and how folks are looking. And as Megan asked, how can other nonprofits get on that list? So it's a great resource for the community for sure. Thank you.
And Scott, I want to do one last shout out, and that is for the United Way. Hopefully, maybe I don't get to be your positive thing to end on today, but if I am, here's a good one.
Okay, you always are.
Yeah, I was going to say, you probably will be. Go on.
So the United Way, of course, is, I know this is near and dear to both your and Megan's heart, and they have created a COVID-19 community relief fund that they are accepting applications from nonprofit organizations in the community who are meeting short-term immediate needs of individuals and families impacted by COVID-19. And they expect most of the applications to be they expect most of the things that they fund, most of the grant amounts, to be in the $1,000 to $5,000 range. So this is not big scale, but this is small. They are taking donations specifically to this fund, and then they're accepting applications to this fund as well. So you can find that at sjunitedway.org.
Perfect. Well, and again, great organization, as you mentioned, and of course I'm on the board, so full disclosure, and Megan has worked as the campaign chairman, so there's that connection. Chairwoman, pardon me.
But yeah.
Chairperson.
Right.
Yeah.
Campaign manager, I don't know.
Chair
anyway.
Megan. But yeah.
Right. Hustling for money, I think, is
go.
ultimately what it is.
But it's a great organization, and we're going to have some folks from the United Way on this week, right?
That's right,
on the
tomorrow.
show to talk about that specifically. So a great lead-in, Liesl Dees. Thank you very much.
Awesome. Well, and Scott, if you need just a few more minutes here, I just want to say that I'm going on 3 weeks that I haven't been to the grocery store. And I know this is one of the things that you want to hear about, people.
That's right.
Right.
We want tips.
Right.
We want tips.
Well, you were a little bit of a gardener, too, if I know you.
No, this is about the grocery store, not the weed garden.
Okay.
Yeah.
Okay.
Well, they're kind of related because, one of the ways that I can extend my not going to the grocery store is eating out of my backyard.
Fair enough.
There you go.
There's a shout out. I have something called Ruby Mountain Oryx spinach that I have grown for years and years, and it's heavily prolific, and I eat it, and I do occasionally eat other things that people might consider weeds in my garden.
Okay.
And,
but healthy.
It's hard to tell. Yeah.
Edible weeds.
edible.
So okay.
Exactly. Let me not encourage your listeners to go out and eat things that they don't know in their backyard. That's
Yes.
not our intention.
I don't
Good
know if
here,
that's
but-
yeah.
And
That's never crossed my mind. But go on.
Understood. And are you going out doing any hunting and gathering in your backyard, Liesl D's, or is this all just?
Perhaps the occasional stray cat, maybe.
No.
Just
Good.
no bats or pangolins.
Gotcha. But you're staying on your diet and on your eating plan and all those things. You're being healthy about this.
Well, and I wanted to do a plug for when you go to the grocery store. Make sure I look for stocking up on not going crazy, but getting an ample amount of shelf-stable items. So, in my house, that might look like going for, say, boxed tofu instead of fresh tofu. In other people's houses, that might look like going for the Pop-Tarts instead of the pastries or bread.
So, yeah.
I didn't even know.
I think there are two types of people in the world, truly. The tofu box people and the Pop-Tart people.
I didn't even know there was a thing called boxed tofu.
I was gonna
So now
say,
I know.
We know who I am, but Scott is a wild card.
Yeah.
What shelf-stable items are you buying these days, Scott?
What did I buy last time I was at the store? I'm trying to remember. Probably not enough, obviously, because I have to go
3
back
weeks.
again this
Yeah,
week.
there you
So
go.
that's my problem. But that's good advice, Liesl D's. I think, again, it's great to remind all of us, if we can limit our trips to the store. I mean, I've been trying to get myself to only go maybe once a week, but as you say, once every 2 weeks, 3 weeks should not be out of the question necessarily.
No, Lisa can do it. We can do it.
I know, and I need to start looking at my backyard. Maybe there's stuff out there I could be eating. I don't know.
Yeah, I'm gonna need some picture, like a picture book.
Yeah.
With actual pictures.
Yeah, let me not encourage you to eat things that you don't know what they are.
Yes, no, that's important.
Purslane is one that I eat throughout the summer.
Right.
But it has not started coming up yet. So
Okay.
right now I'm just eating lots of other greens.
Gotcha.
And I make a juice with them every day. So
That sounds healthy.
Can I throw a Pop-Tart in there? Because that would sweeten the deal.
Yeah, chocolate bar. And I
Yeah,
don't know,
chocolate bar
anything,
and
right? Yeah.
parsley. Anyway,
Something.
thyme,
Purslane,
rosemary.
purslane.
I don't know. Okay,
There you go.
Cool.
But I know there are a lot of folks that are maybe looking into more home gardens this season and this year for like you're talking about, Liesl D's, and that maybe by midsummer or late summer they'll have some crops and some vegetables that they can go out and harvest from the backyard, which makes a lot of sense in these times. So I completely understand. Mm-hmm. Makes sense to me.
well, and let me just say that once you buy your shelf-stable items, you also have to use them. That when you get to that point that you're thinking about going to the grocery store, you got to go open up the cabinet and make sure that you actually eat those things.
That's a good
Great
point.
advice.
There.
Gotcha.
Yeah.
So I should expect a casserole of tofurkey on my
I was gonna
doorstep
say, right?
one of these days?
Yeah, a bag of
Maybe.
weeds,
Maybe.
maybe.
There you go.
Maybe.
Well, Liesl, I appreciate that. And now I have to ask you now because you have us all kind of conditioned for this.
Riveted.
Is there any song today?
No,
Oh.
I did not plan.
Oh, that's
God.
okay. That's
That's
all right.
okay. Next time.
Sorry,
It's okay.
Yeah, I missed it this week, though I did. Do you want me to sing it again? Public service?
I think we're owed that.
What's better than an
personally.
encore?
Yeah,
right?
exactly.
No copyright issues here.
I don't think so.
You may remember this song from preschool that my kids sang this in preschool with a little modification. So these days we are singing, the less we get together, the less we get together, the healthier we'll be, 'cause your friends are my friends and my friends are your friends. The less we get together, the healthier we'll be.
Bravo, bravo.
It's great every time.
Yes. Thank you
All right.
for sharing that.
So many things. Yeah.
Yeah.
Wonderful. Liesl, thank you so much again for calling in, for your musical ability and your backyard recipes.
I was gonna say, woman of many
All
talents.
Very much.
Stay safe, guys.
You too.
You too.
Be well.
Liesl D's from the Community Learning Center here at San Juan College, and always a font of knowledge, literally.
I
I mean, if you ever wanted to know what a font of knowledge was, there's the picture.
There it is.
There's the picture.
There's
right there.
the picture.
There
Literally, there's the picture.
There you go. But yes.
Yeah. Always. So many things.
I know.
All great things.
Boxed tofu.
too.
How many boxes of tofu do you have at your house, Megan Cullop?
I've had tofu.
Got to go to the store?
Yeah, for the boxed tofu. Yeah. Oh man, I forgot the boxed tofu again. I've had it one time.
Okay.
It was a vegan Thanksgiving that I was invited to.
Nice.
Which I feel like speaking of burying the lead, they definitely buried it's vegan lead. So they're like, come over to our house for Thanksgiving. And then I got there, I was like, I don't recognize any of this. What is this? What is going on?
They didn't tell you that it was a vegan.
No, they buried the lead until I got there.
I gotcha. And
they
you
were
couldn't
like,
leave,
enjoy.
and you were starving, and...
Well, I wasn't starving.
Oh,
I mean,
okay, good.
Yeah, we're a developed nation.
Okay.
You know.
But still.
It was fine.
But for Thanksgiving, you maybe
had
other
the purpose
expectations.
of Thanksgiving is to give thanks for the bounty we already have.
That's
and
right.
so I gave thanks for that.
Mm-hmm.
And, it was nice. It's nice. Anytime you have an invitation, right? It's
Of course.
Yeah,
Well,
somebody's home. Very nice.
back in the days when you could go to someone's home and socialize, that's true.
Ain't that the truth?
That is a time that's not around anymore for the moment.
Man, if our Thanksgiving gets ruined, I'll be very sad.
Right?
It's my favorite holiday. Not because of the food, but because you're thankful for the bounty you already
Of
received.
course. Well, I think you could just send people to different corners of the room with a plate. And maybe you could still do it. Maybe.
Right, little card tables everywhere.
Right.
Kind of like a modification of the kids' table.
Little TV tables, I think.
I have a lot of TV trays. If you
you're
need 'em.
out in the garage. You can go.
You're out in the garage.
You can go in the.
Man.
You can go in the backyard. Just watch out.
I hope to make it indoor. The parlor.
Yeah, the parlor. You can be in the parlor with your TV table and your tofurkey.
My tofurkey.
There you go, everybody. Cool. We put up the phone number if you'd like to call in with a question or a comment before we wrap up today's show. But we have a lot of things planned for this week, by the way, everybody. Again,
lots of
San
things.
Juan United Way will be calling in with more details about their COVID-19 local fund and how to apply if that's something that maybe could help you or your business and things along that line. And we've got reaching out to some state officials.
Yeah.
Fingers crossed that we're going to be talking with some of the state folks about the local issues up here. I think they do a good job of talking to the whole state about what's going on. But we have some specific questions that I don't think the Albuquerque media is asking about the conditions here.
That's why we're here, the local information hour.
That's what we're doing. Exactly.
San Juan County.
That's right. So
Also, don't we have Plasma Guy?
That's not his name, but
okay, but
we'll be talking with
he is a plasma guy.
He works in the plasma industry of collecting donations, and as we've talked about, the idea is to get maybe formerly COVID positive cases and patients to donate their plasma to see if that could be helpful with some kind of a vaccine or treatment or
I'm obsessed
what
with
have
it
you. So he'll be talking.
days.
Yes, we are going to talk with him on Wednesday. He has an actual name, and we'll talk to him on Wednesday.
What is his name?
Plasma Guy. Mm-hmm. Yeah.
That's right.
But we'll be talking.
Yep.
Tim.
Okay.
Is his first name.
Tim the Plasma Guy.
Yeah.
I'm obsessed with this whole thing. So
I know you are.
I'm ready.
Well,
I'm ready, Tim.
The science
I
is
hope
interesting.
You're ready. The science is amazing.
Right.
The humanitarian, it is so visceral. It is I've walked through this. I will connect my arm to yours and walk you through it. I mean, it's beautiful.
Right. So there you go. So that's coming up on Wednesday, everybody. And then we are planning to talk to the doctors again on Thursday from the hospital for, again, more detailed information, a little bit more in depth than what Jeff Bourgeois gets into, but more of the front lines stuff, testing, treatments, all that stuff. So we're looking forward to that as well. And if you have a question or comment, you're always free to email us or message us and let us know who you would like to have us talk to on the show.
That's right. Or questions you would ask.
Exactly. Yeah. Exactly. So there you go.
Cool.
So I think we're about wrapped up. So we appreciate that. Again, this is KSJE. We thank our radio partners, KNMI, where you can hear this program on the radio every Monday through Thursday at noon. And again, Monday through Thursday at 5:06 p.m., the audio rebroadcast here on KSJE Radio. So until tomorrow, everybody.
Have a good one.
Stay well, stay safe. See you tomorrow.